Hi, I'm Mark Williams. I'm the project leader for Soteria Strains. I'm here to talk about the PACE mobility status check. The PACE is a quick and easy way to confirm a resident or patient's mobility status in the moment of care. It has 4 parts. We use an acronym, PACE, to remember those. So it's physical, aggression or agitation, communication, and environment. So when we're talking about the physical piece or component, we're really looking at what the patient can do in that moment. So it's a very quick and easy way to look at what they are able to do. That can change from moment to moment. So for example, a patient could in the morning be moved from their bed to their chair with very minimal assistance after being there for a while, or maybe after medications have taken effect, they may be fatigued and unable to come back with as little assistance. They may need more assistance or possibly a piece of equipment. So it's really important that that's understood by the healthcare worker and by the patients and their family as well. With aggression and agitation, that's really the state of mind of the patient. Are they aggressive, or are they at that point of being close to aggressive? So we look at things like, are they talking with clipped speech? Are they agitated? Do they have a history of aggression already? So those are really important things for keeping everyone safe. With communication, really it's about how the patient is communicating, receiving and giving communication. So are they able to follow simple directions? Are they talking back, and are they aware of where they are and what's going on? And the 4th component, environment, is really what's going on in the environment. So are there trip hazards? Is the equipment that's necessary available? Those are really important things to understand. Now, when we talk about actually doing the assessment, it doesn't necessarily have to be in that order. We use PACE as an acronym to remember it, but the order of doing it is really not that important. So for example, you could do it in the exact opposite order of PACE. So you could come in and notice the environment first. You may say hello to the patient or the resident, and then you're starting the check of their communication. Are they responding back? Are they following simple directions as you move equipment around? And through that process, you're always looking at whether or not they're agitated, or if they've had a history of aggression. You would know that even before coming in. And then the last thing might be just checking what they can do based on what it is that you need them to do. So if you're just going to do some mobilization in the bed, you would test that and only that. So it's a very quick and easy way to confirm the current status, the current mobility status of the patient, and that reflects what the plan is in that moment for that patient or resident at that time. So the value of this assessment or check really is that it really gives the care provider the opportunity, that last chance of knowing whether or not they need to change that mobility plan to something perhaps a little more conservative, which can really help to reduce the chance of injury occurring for both the patient, resident, and the healthcare worker.